Good afternoon, doctor. I just read an article about how we need to become unconventional in our approaches to patient education in dentistry. Got me to thinking about that, and I thought, what approaches might be viable? Are there some? And if so, what are they? As I thought about it, I realized that I grew up with a mother who was extremely actually, interested in health practices, in nutrition, in exercise and movement, and taught her 6 children to be aware of them and to learn them and to be faithful to good health practices. So she was constantly teaching us and working with us. And so then I go off to nursing school with that background and before dental school. And as a nurse, I was taught that it's my job to educate patients. And I took that role on with verve and excitement because I loved the idea of educating and helping people. So I got to the hospital setting where we had a lot of very sick, chronically ill patients, just like we do today. And these patients were, they had diabetes spiraling out of control, just like today. They had heart disease, cardiovascular problems, high blood pressure, all sorts of chronic illnesses. And our job was to educate them about what they could do to control and maybe even get rid of a lot of the issues that they were having. And you know what? Guess what? I was amazed to find out, as nice as they were to me, they didn't actually care what I had to say. They showed that by being gracious in their acceptance that I was trying to help, but they wanted the pill, the treatment, the surgery, something, anything, but having to have regular health practices. We are human beings, aren't we? And so pretty much there I was and realized that educating them was a difficult conundrum. And it even spanned the socioeconomic spectrum. It spanned the educational spectrum. It didn't matter how much education they have. It didn't matter how much money they had or didn't have. That was pretty much the rule right across the board. Are you aware of that in your practice? Surely you've been just as frustrated as I in trying to help people in that way. Think about it. Are most of our patients and their parents, for those who treat children, interested in what we have to say? Do they really care? Do they really want to hear what you have to say? They're gracious, they're kind, but do they want to be educated? Do they want to change what they're doing? Do they listen? Do we get anywhere with it? How should we approach this conundrum? That was the very thought I had when I read the article. Can you imagine, as a dentist treating children, to have a mother call your practice and say, Johnny has a toothache again, and he's had decay, and I'm tired of this. I want to come in, and this time, the things you're telling me, I'm going to do them. Would you just please go through them one more time? I'm so sorry not to have heard them before, but now I'm ready, and I want to hear. That would be the big ha, 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 ha in most cases, wouldn't it? But the thing is, in our heart of hearts, we want them to hear it, and we keep trying. We keep spending our precious time working with them. We keep mentioning, we keep paying people in our hygiene department, our dental assistants, to help train our patients, educate our patients. Do they want to hear as much as we want to tell? In reality, are they going to change their habits? What would it take to get them to do that? You know, as dentists, we've been educated to be technical, to be technicians. Our job is a clinical one. We are not trained in education, but even so, in our heart of hearts, we want them to know the things that we know because that's precious to us and we want to share it. So here's the deal I'm thinking because we do care so much, we need to use our educational opportunities, first of all, discerningly. Understand they're not going to hear most of what you have to say, but they are going to hear one thing, that you care. And when you see the patients or parents who are responding to that and who show some interest, who show a glimmer, and they know how much you care, they just might hear some of what you have to say. So the thing is this, think about your patients And I would encourage you to understand that paying patients who don't rely on Medicaid insurance or other insurance to pay for their treatment have already taken a big step toward responsibility and understanding they have responsibility for their lives. Whereas the patients who do rely on someone else paying are not as able to understand in most cases that they can be responsible. So understand in your discernment that a lot of times it's going to be the patients who are the more responsible who are going to care what you have to say and be able to use it. But the thing is this, again, there is a place for a certain amount of education in our practice, and that is using it discerningly to communicate your caring to your patients. The occasional parent or patient who will take it to heart is the exception. And that's one life, and maybe those children of that parent whose lives you can actually change. Things to think about. Dr. Chris, signing off.